Reaching the age of 60 marks a significant turning point in the human biological narrative because the way your body processes, absorbs, and utilizes nutrients undergoes a radical shift. For decades, your metabolism may have been forgiving, but once you cross the 60-year threshold, the efficiency of your digestive tract declines, and the way your organs manage concentrated doses of synthetic nutrients changes fundamentally. The supplement industry is a multi-billion-dollar machine that often markets products to seniors under the guise of longevity and vitality. But the medical reality is that many of these over-the-counter bottles can be more taxing on an aging liver and kidney system than they are beneficial. Today, we are breaking down the essential nutritional roadmap for the senior years by identifying 4 specific vitamins that you must integrate into your daily routine and 4 others that you should strictly avoid unless a specific deficiency has been clinically diagnosed. We begin with the absolute necessities, and at the top of the list is vitamin D3, specifically when paired with vitamin K2. For a senior over 60, the ability of the skin to synthesize vitamin D from sunlight drops by nearly 70% compared to a younger adult. Vitamin D3 is not just a vitamin. It is a pre-hormone that regulates over 2,000 genes in your body and is the primary driver of calcium absorption. However, taking vitamin D3 alone is a significant medical mistake for seniors because without vitamin K2, the calcium that is absorbed is often deposited in the wrong places. Instead of going into your bones to prevent osteoporosis, the calcium can end up in your arteries, leading to vascular calcification, or in your kidneys, forming painful stones. Vitamin K2 acts as the biological traffic cop that directs calcium out of the bloodstream and into the bone matrix where it belongs. This synergy is vital for maintaining skeletal integrity and cardiovascular health simultaneously. The second non-negotiable nutrient for the over 60 population is vitamin B12, specifically in the form of methylcobalamin. As we age, the stomach produces less hydrochloric acid and a specific protein called intrinsic factor, which are both required to strip B12 from the proteins in our food. This leads to a silent epidemic of B12 deficiency in seniors, which manifests as brain fog, extreme fatigue, and peripheral neuropathy. Because B12 is essential for the maintenance of the myelin sheath, which protects your nerves, a deficiency can lead to permanent neurological damage that is often misdiagnosed as simple aging or early dementia. Supplements bypass the digestive hurdles of food-bound B12, ensuring that your brain and nervous system remain sharp and responsive. The third must-take nutrient is magnesium, specifically in forms like magnesium glycinate or malate. Magnesium is a cofactor in over 300 enzymatic reactions, including heart rhythm regulation, muscle relaxation, and glucose metabolism. Many seniors are chronically deficient because of poor soil quality and the use of medications like diuretics or acid blockers, which flush magnesium out of the system. Without adequate magnesium, your heart has to work harder to maintain a steady beat, and your nervous system stays in a state of high tension, leading to insomnia and muscle cramps. The fourth essential component is high-quality omega-3 fatty acids with a focus on EPA and DHA. These are the primary building blocks of the human brain and are the most potent natural anti-inflammatories available. In the aging body, chronic low-grade inflammation, often called inflammaging, is the driver behind joint pain, cognitive decline, and heart disease. Omega-3s help to lubricate the joints, protect the lining of the blood vessels, and ensure that the cellular membranes remain fluid and functional. By focusing on these 4 pillars, you are addressing the most common biological failures that occur after 60. However, the danger lies in the more is better philosophy that leads many seniors to consume supplements that are actively harming their health. Just as some nutrients become more critical, others become significantly more dangerous as our internal filtration systems slow down. Understanding the 4 vitamins you should never take is just as important for your longevity as knowing what you must take. Many of these supplements are staples in the average person's medicine cabinet, but for a senior, they represent a metabolic burden that can lead to stroke, liver toxicity, and bone density loss. We must move away from the idea that all supplements are harmless and start viewing them as biochemical interventions that require precision and caution. In the next part of this discussion, we will dive into the specific dangers of the never take list and explain exactly why these common vitamins can turn toxic in a senior body. Moving into the critical category of supplements that should be strictly avoided or approached with extreme caution after the age of 60, we begin with vitamin E in its synthetic form, typically listed as DL-alpha tocopherol on the label. While vitamin E is a potent antioxidant when found naturally in foods like almonds and spinach, high-dose synthetic supplements have been linked in multiple clinical studies to an increased risk of hemorrhagic stroke and overall mortality in the senior population. The primary danger lies in the way excessive vitamin E interferes with the body's natural blood clotting mechanisms. For an individual over 60 who may already be taking aspirin or other blood-thinning medications for heart health, adding a vitamin E supplement creates a dangerous synergistic effect that can lead to internal bleeding or cerebral hemorrhages. Furthermore, the aging liver finds it increasingly difficult to process and store fat-soluble vitamins, meaning that synthetic vitamin E can build up to toxic levels far more quickly than it would in a younger body. The second vitamin on the restricted list is vitamin A, particularly in the form of retinol or retinol palmitate. Many seniors take vitamin A in hopes of preserving their vision or improving skin health. But for those over 60, the risks often outweigh the rewards. Research has consistently shown that high levels of preformed vitamin A are directly linked to a decrease in bone mineral density and an increased risk of hip fractures. As we age, our bones naturally become more porous, and excessive vitamin A accelerates this process by stimulating the cells that break down bone tissue while inhibiting the cells that build it back up. Additionally, because vitamin A is fat-soluble and stored in the liver, chronic supplementation can lead to subclinical liver toxicity, which manifests as unexplained fatigue, joint pain, and dry, itchy skin, symptoms that are often incorrectly dismissed as unavoidable signs of aging. It is far safer for seniors to obtain their vitamin A through beta-carotene-rich foods like carrots and sweet potatoes, as the body only converts what it needs and safely excretes the rest. The third supplement to treat with extreme skepticism is high-dose folic acid, the synthetic version of vitamin B9. While folate is essential for DNA repair and cellular function, consuming high doses of the synthetic version is particularly dangerous for the over 60 demographic because of its ability to mask a vitamin B12 deficiency. As we established earlier, B12 deficiency is rampant among seniors due to poor absorption. When a senior takes a high-dose folic acid supplement, it can correct the anemia associated with low B12, making a standard blood test look normal even while the nervous system is being slowly destroyed. This creates a medical blind spot where nerve damage and cognitive decline continue to progress unnoticed because the folic acid is hiding the primary diagnostic signal. Furthermore, some studies suggest that excessive synthetic folic acid may accelerate the growth of pre-existing precancerous lesions in the colon or prostate, which are more common in the senior population. The fourth supplement on the never-take list for most seniors is iron, unless a specific iron deficiency anemia has been diagnosed through comprehensive blood work. In younger years, especially for women, iron is a critical nutrient. But after 60, the body's need for iron drops significantly, and men as well as postmenopausal women have no natural way to excrete excess iron. Iron is a pro-oxidant, meaning that in high concentrations, it generates free radicals that cause oxidative damage to the heart, liver, and pancreas. Excessive iron storage, known as iron overload, is a silent driver of systemic inflammation and has been linked to an increased risk of neurodegenerative diseases like Alzheimer's and Parkinson's. For most seniors, the iron found in a standard diet is more than sufficient, and adding a supplement is akin to pouring gasoline on the fire of internal inflammation. Transitioning from what to avoid back to how we optimize the senior body, we must understand the overarching theme of metabolic precision. Supplementation after 60 is not about filling a generic gap, but about correcting specific age-related absorption failures. The goal of a medical-grade nutritional strategy is to provide the body with the highest quality raw materials while minimizing the metabolic waste and toxicity that come from low-quality synthetic fillers. As we move into the final segment, we will explore the nuances of timing and dosage for the essential 4 vitamins we discussed earlier, and how to create a daily rhythm that ensures these nutrients are actually reaching your cells, rather than just straining your kidneys. We will also address the specific lifestyle triggers that can deplete your nutrient stores, and how to recognize the subtle physical signs that your current regimen needs adjustment. To truly master the nutritional needs of the senior body, we must look beyond just the names on the bottles and focus on the timing and synergy of these essential nutrients, because how and when you take your supplements determines whether they actually reach your cells or simply create expensive waste. For a senior over 60, the circadian rhythm of the digestive system is a critical factor in bioavailability. Starting with your fat-soluble essentials, which are vitamin D3, vitamin K2, and your omega-3 fatty acids, these must be taken with your largest meal of the day that contains a healthy source of fat, such as avocado, olive oil, or eggs. Without dietary fat, these 3 critical nutrients will not be absorbed effectively by the small intestine and will likely pass through your system without providing any benefit to your bones or your heart. Taking vitamin D3 in the morning is often ideal because it is inversely related to melatonin production and can help regulate your wake-sleep cycle, providing a natural boost to your daytime energy. Conversely, magnesium should be positioned as your evening anchor, because magnesium acts as a natural calcium channel blocker and muscle relaxant. Taking it about an hour before bed can significantly improve sleep quality by calming the nervous system and preventing the restless leg syndrome and nocturnal cramps that frequently plague the over 60 population. For vitamin B12, the delivery method is as important as the dose itself. Because of the decline in stomach acid, many seniors benefit most from a sublingual methylcobalamin, which is a tablet that dissolves under the tongue. This allows the vitamin to enter the bloodstream directly through the mucosal membranes, bypassing the digestive hurdles of the stomach and the need for intrinsic factor. This ensures that your brain gets an immediate supply of the fuel it needs for cognitive clarity and nerve repair. We also must address the hidden lifestyle factors and common medications that act as nutrient thieves in the senior body. If you are taking a proton pump inhibitor or an antacid for acid reflux, you are significantly blocking your body's ability to absorb B12 and magnesium, which can lead to a rapid decline in neurological health. Similarly, if you are on a diuretic for blood pressure management, your kidneys are likely flushing out magnesium and potassium at an accelerated rate, requiring a higher but carefully monitored supplemental intake to prevent heart arrhythmias. It is also important to recognize the physical signs that your nutritional strategy needs adjustment. If you notice that you are bruising more easily than usual, it may be a sign that your omega-3 intake is too high, or that it is interacting with another thinning agent in your system. If you experience persistent muscle twitches or a fluttering sensation in your eyelids, these are classic biofeedback signals that your magnesium levels are still insufficient despite supplementation. On the other hand, if you feel a strange metallic taste in your mouth or suffer from unexplained nausea, it could be a sign that you are over-supplementing with minerals like zinc, or that your fat-soluble vitamins have reached a point of saturation in your liver. At this stage of life, the goal is not to achieve the highest possible blood levels, but to maintain a steady physiological balance. This is why we emphasize the importance of regular blood work, specifically requesting a vitamin D25 hydroxy test, a serum B12 test, and a red blood cell magnesium test, which is far more accurate than a standard serum magnesium test. These numbers provide the objective data needed to tweak your dosages and ensure you are not crossing the line from therapeutic benefit into toxicity. We also must acknowledge that supplementation is meant to be a bridge, not a replacement for a whole food diet. The complex phytonutrients found in a plate of dark leafy greens or a piece of wild-caught salmon provide a level of biological information that a laboratory-made capsule can never fully replicate. However, because of the modern challenges of soil depletion and age-related malabsorption, these must-take vitamins act as your biological insurance policy against the degenerative processes of aging. By being strategic about your timing, avoiding the high-risk never-take list, and staying attuned to your body's subtle signals, you can ensure that your golden years are defined by vitality and mental sharpness rather than by the limitations of nutritional deficiency. Your health after 60 is a result of the small, precise choices you make every single morning at the breakfast table. It is about understanding that your body is a sophisticated machine that requires higher quality fuel and more careful maintenance as the miles add up. By following this expert nutritional roadmap, you are removing the guesswork and protecting your organs from the metabolic stress of improper supplementation. Stay consistent, stay observant, and remember that in the world of senior nutrition, precision is the ultimate key to longevity. This concludes our deep dive into the essential vitamins for the over 60 population and the dangerous pitfalls you must avoid to keep your body and mind in peak condition for the years ahead.